بسم الله الرحمن الرحيم.
In the name of God, welcome to you, dear fellow journalists and press, in a media briefing on the conclusion of the 71st session of Regional Committee of Emiro Region. We are holding this briefing in Doha as it was generously hosted by the government of Qatar. We welcome all the media colleagues who are present with us and online through Zoom and other social media outlets. It gives us pleasure to be with you today and answer your questions. Dr. Hanan Balkhi, RD of WHO Regional Director, Dr. Adham Rashad Ismail, Director of Program Management, Eastern Mediterranean Regional Office, Dr. Richard Brennan, Regional Emergency Director. As we are accustomed, it will be held in Arabic with simultaneous interpretation into English. You can select the language you prefer to use. For our colleagues via Zoom, please click interpretation to select the language Arabic and English. And on social media, you'll find Arabic on Facebook and YouTube, and on the account of Dr. Hanan Balkhi on X, Twitter, and also on Twitter for Eastern Mediterranean Regional Office. I directly give the floor to Dr. Hanan Balkhi to give her opening remarks. Thank you very much, Ms. Mona. Thank you, Your Excellencies, media colleagues, distinguished guests. I would like to welcome you to this press conference. We have just concluded the 71st session of the Regional Committee for the Eastern Mediterranean, which was held from 14 to 17 October 2024 and hosted by the State of Qatar. Before I start, I would like to thank Qatar for their generous hospitality and excellent organization. I also thank Their Excellencies, the Ministers of Health, heads of delegations, and delegates for their dedication, wisdom, and knowledge. We have enjoyed exceptionally rich and productive discussions throughout the past 4 days. The regional committee session was held against the backdrop of emergencies that unfortunately affect half of the countries of the region. We are all acutely aware that precious lives are being lost every minute. From the 12-month war in the Gaza Strip to conflicts in Lebanon, Sudan, and Yemen, and prolonged crises in Afghanistan, Somalia, and other countries, our region is facing unimaginable and unacceptable tragedy and suffering. The theme of the session, Health Beyond Borders, reflected the strong commitment of all our member states to work together to ensure that every single person in the region can enjoy their fundamental human rights to life and health, no matter their location, nationality, economic, or social affiliation. The Regional Committee is WHO's main governing body in the Eastern Mediterranean. This annual session is an essential opportunity for leaders and policymakers from member states to join partner organizations and WHO experts to consider key issues. Naturally, much of our time was spent discussing emergencies and other challenges, but we were also able to celebrate numerous successes in every country and across many different areas of public health. From the tremendous growth of our regional healthy cities program, for instance, to some world beating achievements in tackling communicable diseases such as hepatitis C, leprosy, and malaria. Coming together for these annual sessions is a great chance to share experiences, inspiration, ideas, and best practices. This was my first regional committee since I became regional director in February. I was pleased to be able to present WHO's major strategic plans for our work in the region. including a new regional strategic operational plan and three flagship initiatives. The strategic operational plan will guide our work with countries for the next 4 years, while the flagship initiatives will help to accelerate progress in three critical areas: expanding access to essential medicines, vaccines, and medical products. The second, investing to improve the production, employment, and retention of health workforce in the region. And the third is stepping up public health action on substance use. I am delighted that member states voiced their strong support for these plans, and they also provided much wise advice and feedback. We also discussed technical papers on four major health issues. The first wi- was a new operational framework for addressing physical trauma in humanitarian settings. Second, a new regional action plan to enhance mental health and psychosocial support in emergencies. The third, action to tackle the deadly threat of antimicrobial resistance in the region. The last, harnessing the power of digital technology to improve health information systems and healthcare. And we had a very full program of other discussion, briefings, side events, and special events. I encourage you to look at the documents on the Regional Committee website. There is a wealth of information there. Our big meeting has concluded successfully, but our work is just beginning. I'm looking forward to pushing on with the technical agenda endorsed by the committee. So we say goodbye to our friends, colleagues, and partners today, but we will be in touch with them again soon, and we will work closely together to make our shared vision a reality. Thank you very much. And back to you, Mrs. Mona. Thank you very much, Dr. Hanan Balkhi, for this opening statement and allow us to open the floor to receive questions from the hall or via Zoom. And also, we have received before this PC a number of questions, which we will respond to them all.
Peace be upon you. I am from Sharq newspaper. The question indeed is launched based on the slogan of these meetings. Health Without Borders. Are you able to implement this slogan on the ground, given the disasters of Palestine, Lebanon, and Sudan, and in many other countries in the region, particularly that many hospitals have been targeted both in Palestine and Lebanon? Even the healthcare professionals themselves were targeted. To what extent are you able to implement this slogan on the ground? Thank you very much for this question. Indeed, it's very important, and in fact, harbors many issues that I have addressed, namely that our region in particular needs sustainable peace, hopefully. However, until this peace is achieved, we are prepared, and we are exerting our utmost effort to achieve the slogan of health beyond borders. We focus, therefore, on the initiatives and innovation to reach those displaced not only once, but maybe twice or three times. We also talked about the nationalization of pharmaceutical production, and which means much, and this nationalization, and at the same time this exportation to countries abroad, this requires much work. It is only the tip of the iceberg. Many people do not see what we do, but most of the work that we do in WHO is going to accelerate health beyond borders. However, this doesn't really mean that we have a magic wand to solve the problems of the region. If I say that I would be, if I say that, I don't think I will be honest. But as I told you, we will never stop talking about targeting health facilities, the migration of the physicians and health professionals from the region. And we will keep and continue the discussion with member countries in order to make the manufacturing of pharmaceutical products nationalized. And at the same time, we want to make our region more attractive. We cannot do any of this without peace, but member countries are completely ready and prepared to find innovative solutions to this. Thank you, Dr. Hanan. The gentleman here has a question. Thank you very much. I am Musa Al Jarna from the Qatari uh, press agency. And Dr. Hanan addressed the question of the plants in areas with that experience emergency. But I'd like to say, and I know that this is not in the hands of WHO, what are the mitigation plans that you have? There are many healthcare professionals that were targeted. Many families cannot get access to treatment. So, how can this be addressed? Dr. Hanan and then Dr. Rick. I'd like to start with providing you with an overall picture, and then Dr. Brennan will be giving you the details. With respect to immediate support, we continue to advocate and call for the access to aid in all areas where there are conflict. Unfortunately, we haven't been able to achieve much success. We are achieving very small steps of success because of the tremendous numbers. At the same time, we try to provide medical supplies and medicines in areas where conflict is expected. This happened in Lebanon, for example. At the same time, we work on providing training to health cadres and emergency response teams, as well as mass emergency situations. What we are trying to do is trying to face up and do the preparedness in areas where there are no conflict, mass gathering, emergencies, access to healthcare, and providing healthcare to most at-risk locations. This is why we work closely with the ministers of health and with the health professionals on the ground. We also work collaboratively with other organizations who help us in this regard as partners. But now I'd like to give the floor to Dr. Brennan, the Director of Emergency Programs, so that he can complete your questions, responding to your question.
Yeah, thank you very much for a great question. As Dr. Hanan said, we do a lot of advocacy on the peace element of the crises, of the conflicts, but we're not making much progress. We're not getting the ceasefires that we want. But we continue to advocate to get access to people in need. And we do that consistently across all those big crises like Gaza and Sudan and Lebanon. As Dr. Hanan said, we also work very hard with our partners to ensure that there's access to essential health services. For example, we've brought in around 22% of the medical supplies into Gaza. 2 weeks ago, we brought 4 plane loads of supplies into Beirut with the support of the government of the UAE. We also are helping to deploy international teams, emergency medical teams into Gaza. There are now 15 emergency medical teams in Gaza operating in 10 field hospitals. We're helping to facilitate their arrival into Lebanon as well. The other issue is controlling disease outbreaks. You're aware of the polio outbreak in Gaza. We've just finished the first 3 days of the vaccination campaign in central Gaza. We've vaccinated 181,000 children under the age of 10 there. We recently undertook a major vaccination campaign against cholera in Lebanon, 350,000 people vaccinated there. The other important area that we work in is the training and development. As Dr. Hanan said, we trained over 120 hospitals in Lebanon before the conflict on trauma management, mass casualty management, and we play a vital coordination role as well with partners working in the health sector to make sure that needs are addressed. We minimize duplication. So we're doing. It's a long answer to your question. We're doing a lot to mitigate. We'd like to prevent more of the conflict, if at all possible, and we will continue to advocate on that as well.
شكرا دكتور حنان.
Thank you, Dr. Hanan, Dr. Rick. And before I go back to questions physically, let us take a question by Independent Arabiya to Dr. Adham. It says the psychological effects will remain after the current conflicts are over. They will be inherited by younger generations, and most likely the healthcare systems in the countries of the region will remain unable to deal with the real dilemma. Does the WHO have a plan or vision to deal with the neuropsychiatric condition of the people? Allow me to answer the question in English to make sure that all terms will be precise.
I think one of the important issues that we discussed in this regional committee was actually the mental health and psychosocial issues that accompany the conflicts and emergencies, and this was one of the papers that we discussed today. But it also, most importantly, it was one of the flagship initiatives of the regional director coming into her position. She was fully aware and had a vision that this is something that we have to all attend to. It goes without saying that conflicts and emergency settings and all what we've been experiencing had a positive trend on anxiety, depression, and also on substance use at some point due to traumatic experiences of lost loved ones. So this is something that was high on our agenda in this meeting. We discussed mental health. We developed a framework in emergencies on how to integrate mental health into our emergency response, and of course, psychosocial support for all those who are suffering right now from different emergencies in the region. I think the model and the framework that integrates it into primary health care so that even in the dire places of conflict, still we can be able to provide these services to places under conflict or not under conflict within the same settings or within the same country. So this is something that we are aware of. We have developed a framework, and thanks to the regional committee and member state who have endorsed this framework for us as secretariat to start working on this on the framework and to develop an adequate response to the ongoing emergencies.
شكرا لك يا دكتور.
Thank you, Dr. Adham.
And Asian Telegraph. As a regional office, are you facing any challenges from the member states meeting your goals?
From the member states,
As a regional office, what kind of challenges if you are facing from the member states?
Thank you very much for this question about challenges from the member states. The member states are the main partner, and it's really what our work needs to create an impact on the ground in the member states. So it's not really challenges by them, but it's challenges within the complexities of the member states, if I may phrase it. I think we endorsed 6 resolutions during this regional committee, 71, and all of these resolutions have great visibility on what needs to be done on the ground. And these resolutions also, especially the regional operational strategy and the 3 flagships, it was really extrapolated from their needs, their demands, and through discussions with them. So I think that our biggest challenge, of course, would be enabling us to implement what we would like on health related issues in a timely fashion to save as many lives as we would wish to, the resources. So that's one thing. The other thing, the one of the other challenges that we would face in our member states in the region, but they're not specific to this region, is the fact that a lot of the health agendas are outside of the health sector. And that's something that's extremely important for us to be aware of. Some of the solutions don't lie within the health sector. They lie within other sectors. So the multisectorality of our agendas at the country level requires even further engagement with our member states, further empowerment of our staff, and diversification of the skills and the talent that we have in the country offices to work with our ministries of health. So we're going to find ways for all of these challenges and try to think out of the box in more innovative ways to address these issues. Thank you.
شكرا لك دكتورة.
Thank you, Dr. Hanan. And we have a question on a request to pose a live question. Dina Abirad, please introduce yourself and your news agency and to whom you're addressing the question. Thank you for this opportunity. My question to Dr. Hanan Balkhi. I'm Dina Abirad. I'm a certified journalist at the UN at Geneva and a correspondent to a number of news agencies. My question, Dr. Hanan, about the situation in Lebanon. More than 1.2 million people were displaced from Beqa, Beirut. They were internally displaced. What is the health situation in Lebanon? Therefore, with the deteriorated security situation. Another question, we know very well that you are taking care or concerned, mandated with a region that is affected by conflicts and wars. The issue of funding was very crucial to the region. To what extent you have the funding resources to cover all these files, especially due to the fact that the war is expanding further in the Middle East, like in Lebanon, and it will expand further in the region. Thank you. Thank you, Dina. Dr. Hanan will take this question, then followed by Dr. Rick. Thank you very much, Mona, and I'm happy to hear your voice, Dina. I hope you are good and your family members. Let me take the second part of your question and leave the first part to Dr. Rick Brennan to respond to the first part. Your question is on funding, Ms. Dina. Well, regarding funding, the key funding sources do not exceed 40% of our needs. And funding emergency programs do not exceed 29 or 30%. These are frightening or alarming figures, especially that the need keeps increasing. So funding rates would always be less than our needs. We are so clear at WHO that wherever we are located and wherever there are resources, we would exist on the ground to respond, to help, to provide support to the member states that require assistance. And we are never lagging behind in this. The only thing that may prevent us to do everything we desire to is the funding resources. So in the financial discussion that was held in the last biennium, we discussed that we will try to explore more resources in order to bridge the funding gap or the budgetary gap of our organization. But this would require huge and immense efforts at the regional level and at the level of WHO as a whole. Resources and donors, their capacities and their numbers keep receding, especially with the increased conflicts. But we are detecting and we are identifying our needs very transparently, and the needs keep increasing. Now I move on to Dr. Rick to take the first part of the question. Thank you.
Thanks very much, Dr. Hanan, and thank you for the question. Well, I think the health and humanitarian situation in Lebanon right now can be described as critical. It's a desperate situation. We have major concerns in the health sector. Of course, perhaps the most obvious concern is the high levels of trauma and injury. Over 2,000 people have been killed because of the Israeli attacks, and over 10,000 injured. That puts a huge burden on the health system. And even prior to the conflict, that there are a lot of political and economic struggles in Lebanon, and the health system was already working at a substantially reduced level. In addition, because of the insecurity and because of the evacuation orders of the Israeli forces, now we've had 6 hospitals that have been fully evacuated. We have another 5 that are partially evacuated. We've had 23 attacks on healthcare and over 70 people, healthcare workers, patients, and so on, and others killed. So trauma is a huge issue. We are trying to help with the support that I mentioned earlier, bringing in supplies, training healthcare providers, and so on. Second big issue is just the massive levels of displacement that you mentioned. By some estimates, over 1.2 million people acutely displaced away from their homes, living in overcrowded shelters, poor sanitation, and that poses major risks for disease outbreaks. Yesterday, the Ministry of Health confirmed the first case of cholera. That is a major concern. So we are working hard with partners and under the leadership of the Ministry of Health to try and get on top of that development. But there's also the risk of other infectious diseases. Thirdly, just making sure that people have access to basic health services. People who need kidney dialysis, patients with high blood pressure, with diabetes, with heart disease, they need access to their regular medications. But when they're forced from their homes and the health system not, being degraded, it's very hard to give people access to the life-saving services they need in and out, day in and day out. So again, we're working with the Ministry of Health, trying to support primary healthcare services and hospitals, bringing in partners, helping very much with the coordination there. There's a massive mental health dimension to this. Dr. Adham referred to that in his remarks earlier. And again, we are working with the ministry to try and address those problems. Of course, there's a spillover effect into neighboring countries. Almost 260,000 people have crossed the border since the start of the conflict into Syria. And again, we are working with the authorities there, with other UN agencies like UNHCR, to ensure that those people who have been forced across the border have access to health services. So it's a critical situation. The United Nations system has activated its highest level of emergency response, what we call system-wide activation, as has WHO. This is a grade 3 emergency for us. This is all hands on deck, and it's because of these critical health and humanitarian needs.
شكرا لك دكتور.
Thank you, Dr. Rick Brennan. And before getting back to the poll, we have a question from Monaid from Al Ahram economic newspaper. The question is to you, Dr. Adham, with the further complication of crises and challenges, how do states prepare for such crises and challenges, and how can they improve their own economic situation?
Let me say that WHO is through the under the leadership of Dr. Hanan is actually taking a very new route into addressing challenges, especially in addressing emergencies. First, something that an initiative from the Director General on strengthening country offices through what we call core predictable country presence. That is increasing the number of staff in emergency countries, DNE, putting more staff on the ground for WHO to be able to respond to the emergencies that is happening in a more effective way. The second is when the regional director took office, she was really keen on identifying emergency as a top priority through member state selection in her regional strategic operation plan, which was discussed during the regional committee and was endorsed by member states. And in this top priority, this means that the regional office will work and focus on delivering impact in country offices that are under emergencies, and that will be our prime goal. All the regional office staff and resources will be addressing and responding to the emergencies in the best possible way and in the way that member states have selected us to respond to. So there will be really a good response from the regional office based on this plan. The third and most importantly are accelerators to that plan, which is the flagship initiatives. I've already discussed mental health, which is part of the substance use. We're trying to limit the use of substance use during emergencies because of mental and health issues and trauma. But also, there's two other flagship initiatives. One of them has been addressed by Dr. Hanan, which is, of course, about health workforce and their migration and the attacks on healthcare, and how can WHO close the gap in emergencies and also in non-emergencies, and retain healthcare workers in these dire conditions. And the third one, and the most important, and I have personally served as a head of WHO office in emergency countries in Iraq and Yemen. And the number one topic that I always discussed with the Minister of Health of these countries during those emergencies was the access to medicines and drugs and medical devices. And that's a top priority for Dr. Hanan to make sure that we supply the necessity commodities that will help our health workforce deliver in these dire situations, in conflict affected areas, and most importantly, in hard to reach areas where we cannot provide the services ourselves, but we rely on our partners through supplying them with adequate supplies as well. Thank you.
شكرا لك دكتور أدهم.
Thank you, Dr. Adham. In fact, we have a number of questions on Zoom for direct to be posed directly. I'd like now to give the opportunity to Mustafa Hagag, and please tell us to whom are you addressing the question. Peace, good evening. I am Mustafa Hagag from Akhir Al-Anba portal. In conclusion of the Regional Committee 71, would like to know what are the most important resolutions regarding health emergencies, and what are the latest development concerning the pandemic agreement and polio. The question is to Dr. Hanan and Dr. Rick. Dr. Rick, would you like to take the question?
Certainly, thank you. Well, in terms of the resolutions, as Dr. Hanan said, we had 6 resolutions. 2 of them were related directly to emergencies. The first one was addressing the growing problem of violent trauma in humanitarian settings across the region. We've already touched on this with respect to Syria and Lebanon, but I think it's important to note that we have, as Dr. Hanan indicated earlier, many of our countries are impacted by humanitarian crises. Last year, across the region, there were 8 countries that had over 1,000 conflict-related deaths. And there are huge gaps in providing trauma care to people with violent injuries. And these are special types of injuries. These are blast injuries, partial amputations, burn injuries, penetrating injuries, complex injuries that require dedicated and sophisticated care. And in the countries where we work, there's a lot of degradation of the health system, lack of staff. So we have a dedicated program that really tries to fill that gap and make sure that people who have violent injuries in even the most remote or difficult circumstances have access to care, from the point of injury through the ambulance system to perhaps the first clinic or hospital in which they arrive, and then onto the referral hospital system. So we've devised this program. We've already documented quite a lot of success in recent years. People we've trained have responded to over 800,000 injured patients in the last couple of years, and I've already mentioned the work that we've done in Lebanon, doing mass casualty management training in over 120 hospitals and undertaking drills in 112 of those hospitals. So we're excited about that resolution. It's going to ensure that we can better provide trauma care in conflict and natural disaster settings. The other important resolution related to emergencies was referred to by Dr. Adham earlier. It's the Regional Action Plan for Mental Health and Psychosocial Support in Humanitarian Settings. About 22% of individuals in conflict settings will have a mental health problem. And we have a range of services that can be provided at community level, at the first port of call at the primary healthcare clinic, all the way to advanced psychiatric services. The action plan is built on our experiences. A lot of people who have mental health problems, amongst the best things you can do for them is give them control over their lives. So we work with other sectors to make sure that people have shelter, have access for food, and protect their kids. So it's not just the health sector that needs to respond in these circumstances. We work with other sectors. We also train frontline health workers in what's called psychological first aid. They may not be psychiatrists, but they can provide understanding and compassionate care to people whose lives have been turned upside down by violence and disorder. As I understand it, you also asked a question about the current status of polio. We've got we've got a lot of issues related to polio across the region. Let me just address the current outbreaks in Gaza and Lebanon. No, sorry, in Gaza, not Lebanon. It's cholera in Lebanon. Forgive me, I misspoke there. So, as I mentioned, we have had the first documented case of polio in Gaza several weeks ago. We are now into the second round of a major vaccination campaign. The first round, several weeks ago, we vaccinated 560,000 children under the age of 10 under unbelievably difficult circumstances. We were able to negotiate a humanitarian pause so we could get access to those kids. We reached around 95% of the kids we wanted to reach. Now we have to do a second round, and we're doing that in 3 phases: in the center of Gaza, then in southern Gaza. We still have to negotiate access to northern Gaza, and that hasn't been guaranteed yet, but we're working on that every day. We've just wrapped up the first few days of the Central Gaza campaign. We vaccinated over 180,000 children. And again, it's not just WHO, it's with the Ministry of Health, it's with the UNICEF, it's with UNRWA. That was a very successful exercise, again, reaching over 90, we estimate around 100% of the children we wanted to reach. But there's a lot more work to be done. And again, the success of this campaign will absolutely depend on negotiating a ceasefire. We do hope and pray that the Israelis give us access to all the children in need, including in the north, where the most intense military operations are ongoing right now. Thank you.
شكرا لك دكتور.
Thank you, Dr. Brennan. Are there any more questions in the hall? Yes, please.
My question is more on on the domestic level here in Qatar. As you might be aware, a lot of patients from the Gaza Strip have been evacuated here to Qatar and they're receiving treatment here. Uh, did you get the chance to visit those the Palestinian evacuees in Qatar? And were there any initiatives possibly discussed between the World Health Organization and Qatari officials here regarding on providing better care for them, let's say the mental health perspective as well, because it's also part of the treatment especially with a lot of children suffering from psychosocial um, issues due to the ongoing genocide in the Gaza Strip. Thank you.
تفضلي دكتورة حنان.
Thank you very much. And I think a great question. I would like to, as from WHO, to very much thank all the member states who have really taken in and received the evacuated patients from Gaza, including the state of Qatar. And indeed, I did have the opportunity to visit a Thumama complex. I think Qatar has received patient-wise close or over 900 patients, and much more when you count the companions. And at the Thumama complex, we were able to visit 3 families, and we were able to interact with them and really listen to their stories. The types of traumas that they have received and describing them. There was a teenage girl with an above knee amputation. There was another young man who had significant spinal muscular dystrophy of a very advanced stage, who has really almost been saved because it's a very complex disease with a lot of needs when it comes to respiratory support and also physical support, because almost quadriplegic in a way, very devastated situation. very brilliant young man, and an elder who had fell under the destruction of his apartment where he was trying to run away from the damage, the significant damage that happened to his house, and ended up with thoracic vertebra, backbone fractures, rib fractures, hematomas, and also pneumothorax, so bleeding within the lung space and within others. And they are all doing extremely well, thriving very well. The kids are going to school, they're integrated in the community. And in fact, in the pre RC 71, where there's usually a walk the talk event, we were very pleased to interact with the Palestinian youth who have been integrated within the schools here, and they had their own football team, and the a bit older or younger adults were trained to become coaches for soccer. So I think that Qatar has been doing an amazing job. They have also voiced in our other meetings on how to ensure that we can support in a more systematic way. And that's not only Qatar, several other countries are relying on WHO's ability to support on the evacuation of the Gazan patients. And they have asked us to work more on establishing robust institutionalized mechanisms to evacuate more patients to Qatar to receive health care. So I hope that satisfies your question. But I think that there's a lot that has been done for the patients from Gaza.
شكرا لك دكتورة حنان.
Thank you, Dr. Hanan. We have Abdurrahman Hashim, Musa Asi, and Jamie Caton online. Abdurrahman, please pose your question. Abdurrahman Hashim, can you hear me? We move to Musa Asi. Please, the floor is yours. Musa Asi. ممكن تفتح المايك؟ Mr. Musa, are you with us? I'm Musa Asi from Geneva. Welcome, Dr. Hanan. My question relates to Lebanon. Over the past 2 weeks, the citizens in southern Beirut and after the attack and the air strikes by Israel, there were very bad odors. Do you receive any reports from Lebanon that indicate the use of specific types of weapons that cause this type of foul odor? Or the use of phosphorus, because we've heard reports from more than one source that these foul odors were prevalent in southern Beirut. Thank you, Mr. Asi. Would you like to start? Dr. Brennan.
Um, so we have heard reports of the use of white phosphorus of patients coming in with burns of from white phosphorus from the use of white phosphorus coming into the hospitals. In terms of bad odors, I'm not aware of the use of any other weapons that might cause bad odors. We did hear of one report of a possible use of a particular type of uh, material, but they were not substantiated. So I think when you have that level of destruction, you often have destruction of uh, gas pipes and so on. There's a lot of reasons for bad odors in a conflict zone. We're not aware of the use of any weapons that would cause those bad odors, but we have heard of cases of patients coming in that have been exposed to white phosphorus and suffered injuries because of that.
شكرا لك.
Thank you, Dr. Rick Brennan. Jamie Caton, are you still online?
much, Yassine, for giving me the floor. I'm Jamie from Associated Press in Geneva. I just wanted to kind of take a step back. We've all seen the casualties, the death, and the destruction from this conflict over the last year. I'd like to ask, how have Israel's increasingly tense relations with the United Nations and the military operation in Gaza and in Lebanon over the last year specifically affected WHO operations? I'm not talking about the healthcare system in general or hospitals, but or the response to the casualties, but specifically WHO EMRO over the last year. What was the difference between before October 7th and after October 7th in terms of your own operations in the region? Thank you so much.
شكرا لك.
Thank you.
Much for this question. Of course, WHO is a member state organization with 6 different regions. So Israel is not part of the EMRO region, so we don't have direct interactions with them when it comes to programs. It is part of the Euro region. However, on the ground in the occupied Palestinian territory, the WHO country office works closely with COGAT in trying to establish the ceasefires. So in that perspective, of course, like any of the other organizations, we have been having major problems in accessing certain zones, and we have been prohibited from entering in certain zones. And you've probably been following specifically going into the north. It has been a big challenge. So there are other issues in relation to the evacuation, where there needs to be proper coordination between WHO, the Palestinian Authority, and also with COGAT on the evacuation and the criteria of the access and of the entry of the aid into Gaza and the occupied Palestinian territory. And we have been having significant challenges in making sure that the access is unimpeded, and so that has been the situation. So I hope that answers your question, but it has been a very difficult process to try to establish a really free-flowing access into Gaza and free access outside for the injured to leave the country. Over.
شكرا لك.
Thank you, Dr. Hanan. The last question online, Mr. John Zarokastis. Please go ahead with your question, Mr. John.
Good afternoon. My question is both Dr. Balkir and Dr. Brennan. I was wondering, you just mentioned earlier in your briefing that the EMRO is heavily affected by emergencies and attacks on health. A huge number have been killed and injured across many of the EMRO countries. Next month, heads of state will be meeting in Brazil for the G20 meeting, and that includes one country from the EMRO region that is a member of the G20. Do you hope or aspire that the issue of attacks on health will get visibility at the global level, heads of state level? Thank you.
شكرا لك. تفضل.
Thank you, Dr. Hanan. Dr. Rick Brennan, please take this question. Dr. Hanan would conclude the PC.
Hi, John. Always good to hear from you. You always have the right questions. We're terribly concerned about attacks on healthcare. WHO, as you know, has been documenting attacks on healthcare since early 2018 worldwide, not just in our region. In our region, since the start of that monitoring process, there's been 3,680 attacks on healthcare, and that was up until yesterday. That's 1.5 attacks on healthcare per day in this region. That's just unacceptable. It denies people's right to health, and it's an absolute violation of international humanitarian law with the Geneva Conventions. Since the start of the conflict, since October the 7th last year, we have documented 1,100 attacks on healthcare across 5 countries. So it's a major problem. You've heard just how forthright WHO has been on advocacy on this. Both our Director General, Dr. Tedros, and Dr. Balkhi herself taken this on as a very important issue. Now, is this on the agenda of the G20? Not to my knowledge at this stage, but you may be aware that here in Qatar next month, the Wish summit is very much taking on the issue, and there will be a major paper on a tax on healthcare to describe the extent of the problem, to describe how it impacts people's access to healthcare, and to describe how all the preventive measures that we have in place, like the Geneva Conventions, like all the humanitarian diplomas we do, is just not working. So of the 3,680 attacks that we have documented in our region in the last few years, not one person's been held to account. So there is gross impunity for attacks on healthcare. And we are in this paper next month. There will be a lot of recommendations about how to strengthen international diplomacy to take on the issue. And I think your suggestion about taking it up to the G20 is a very good one. There will also be very concrete recommendations about what healthcare providers and organizations can do on the ground to mitigate the attacks on healthcare, so they limit the impact on the delivery of health services, because the preventive measures, which are primarily political in nature, just aren't working right now.
شكرا.
Thank you, Dr. Rick Brennan. Dr. Hanan, would you kindly give some closing remarks to conclude this press briefing? Thank you. Thank you very much, dear press and media colleagues and colleagues here and on Zoom.
Being with us today. I'm doing it a bit English and Arabic so that the acknowledgement goes fresh to everybody who can hear me. Again, just to repeat that we are in a very difficult time, but I'm very energized after this RC. And here from Doha, I think we've got very much motivated to work to move forward with our agenda. وإن we will هنستطيع.
And inshallah, we will, through cooperation with member states and key partners, we would be able to implement the strategy for the following 4 years and until we meet again in a press briefing. Thank you. Thank you very much, dear colleagues. Stay safe. Goodbye.